Thank you very much, John, and really happy to be here today. I first of all want to acknowledge the territory of the Kahnawake. Very happy to be here in your territory and honored to be able to speak to you today. What I'm going to do in 12 minutes is try and capture what we've tried to do. What you have here is a 10-year time frame, and it's really a lot longer than that. You've heard the history of Canada. I think what Malcolm covered was really interesting and exciting when you think about that history and when you look at British Columbia within that history. And recognizing that what we've done in British Columbia, in my mind, I describe it as the largest self-determination decision ever made in the province of British Columbia, maybe in Canada, because we were largely, as was said, non-treaty groups. There are a few historic treaties, a modern day treaty process that's limping along. And we have 203 First Nations of British Columbia of the 630 or so that are in this entire country. So the history of British Columbia is unique in relation to not only do we have so many Indian bands recognized under the Indian Act, but we have no formal arrangements for the most part with BC and or Canada. And so that's really important backdrop for us as we move our work forward, as you heard about some of the challenges in relation to discussions and the idea that the formal agreements, treaties, being legally binding agreements, and in Canada, in our modern treaty process, constitutionally protected agreements, you really wonder about the integrity, first the language and the spirit and intent. And sometimes we find that the legal agreements can create challenges. But that being said, what you see in this timeline is a story of 10 years of work where we've done a lot of work to negotiate and implement a governance structure, a new governance structure between the province of British Columbia, the government of Canada, and BC First Nations. And what I would say about that is to recognize that, and you see the way that the two timelines go. You have a blue line and a red line, and the origins of it come back to talking about coming full circle in 2005, an arrangement that was put in place with the first of its kind tripartite arrangement with BC and Canada, the Transform and Change Accord that was signed by, at that time, maybe one of the last things signed off by Paul Martin, the Liberal Prime Minister at the time. So we spent 10 years working with the new government, advancing our work. And it was interesting because what was really important in British Columbia in November 2006, a year later, there was a bilateral plan released. And in that bilateral plan, it was very clearly articulated that the bilateral plan between the province of British Columbia and BC First Nations, as a result of the Transform and Change Accord, was really identifying that the provincial services were responsibility of the province and available for all British Columbians. So provincial health services available for all British Columbians, including First Nations people. So it's that notion that we are legitimate, we are part of the province, and that the province does have responsibility to provide services to First Nations people, regardless of where we live, so on or off reserve. And as you know, Indian Act reserves are federal jurisdiction. But there is the opportunity and the responsibility of the provincial health services to extend to our people that live in communities. What we find is that the health services that we transfer from the federal government are not the full suite of services that First Nations people require, and are also, as was described by Dr. Smith, very programmatic and very siloed, and very much a problem in relation to implementing those pieces. So what we did moving forward is implement the rest of these agreements, and what I would say is between 2007, it took 6 months after the bilateral plan was released to get Canada back into the mix. Interesting how a new federal government didn't want to pick up the work of the previous federal government, and so it took a bit of time to get them back to the table. And we began a process that first started with the recognition that in our bilateral agreement that First Nations should be involved in the design and delivery of services for First Nations people, but they also, moving forward with a tripartite arrangement, we went further to even look to implement a new health governance structure for health services for First Nations people in British Columbia. And I think that was really interesting discussion and dialogue for us to work as First Nations among ourselves to create a partnership. And that partnership for us was important. We built consensus among 203 First Nations communities to come to agreement to say that we would work together on one agenda, one umbrella of health, to govern and take control over our health affairs that matter to us, and that we have the right to do it because our right to self-governance is protected already under the Constitution of Canada. And we don't have to have it defined in a treaty. We don't have to have it defined in a self-government arrangement, but we collectively, because some do have those defined that way, with those that don't, came together to make that decision. That was really important around that notion that we could take care of ourselves. And so that's been the premise of our work moving forward, and we built a tripartite partnership, a health governance partnership with BC and Canada. And reciprocal accountability was something that we built into it because it was important to us to recognize that we're all taking accountability for the outcomes and the goals we're setting for ourselves in our health plans. And that was going to mean that First Nations would be at the table making decisions on those things that mattered to them. Now, this is the health governance structure we put in place, and I think it's important to recognize that BC First Nations, through that red line that ducked out and back in, it was a 4-year period, and we engaged among ourselves and probably had 130, 140 different engagement sessions within the province of British Columbia, sometimes at a community level, a local level, sometimes at a nation level or a sub-regional level or a regional level as we define the regions with the Regional Health Authority guide. There's 5 regional health authorities in British Columbia, or provincially. And so we had the conversation among ourselves, built consensus, and designed this governance structure through First Nations governance and teachings for First Nations people, to be delivered by First Nations people. So it's very important that we start talking about First Nations governance institutions. That would be the heart of the work that we do moving forward. You see on one side a First Nations Health Council that represents our political voice, our governance voice. First Nations health directors on the other side, the folks that are running our mandated health organizations in our communities. Then the First Nations Health Authority, which is really the operational arm for the whole implementation of this, including the delivery of services that we transferred from Health Canada, the negotiation of new services with the provincial government, and the supporting of the First Nations Health Council and the Health Directors Association. So it's been an interesting journey, recognizing that how we do this work is with continual engagement of our First Nations communities on a regular basis. Now, just a quick slide here to give you a sense of, in building consensus, communities, First Nations leadership worked hard to advise us of what this should do, and the direction that we get from them is reflected in this vision statement. It's a shared vision statement that we hold with the First Nations Health Council, the Health Directors Association, and ourselves at the First Nations Health Authority, a shared set of values and 7 directives. And it's interesting when you see the 7 directives, I would point to number 6 that talks about without prejudice to First Nations interests, because we do have treaty groups, we do have non-treaty groups, we have self-government groups, and we have groups that are negotiating treaties. So again, reinforcing the fact that First Nations' right to decision-making in this country is recognized in the Constitution, and we just need to get up there and do it and have that authority recognized. And it's interesting when we talk about that notion of authority, because as we were negotiating our arrangement with the province of British Columbia and the government of Canada, the province, who has the responsibilities of health, as we all know, creates regional health authorities and a provincial health authority. And they were very troubled by us saying that we're going to implement a First Nations health authority, because they thought they were the only ones that had the authority to do that. What was really important was to express to them that the authority of the First Nations Health Authority comes from First Nations, the right to self-governance. That's our authority, and it's not theirs to give or take. And so it's interesting because in the early days, it was very fearful, but now as you build partnership, and because we recognize that to be successful, we need to work in partnership with everyone. And we build partnership based on our values and principles in this foundation, that the provincial government, the federal government actually are very excited now about what the First Nations Health Authority offers them in solving issues that they could never solve. In British Columbia, because of the history of colonization, they created 203 Indian bands, as I mentioned. And they can never get those 203 Indian bands on the same page with anything. And so we're able to do that under a health agenda, but it's hard work. But we continue to do that work moving forward. So it's quite an exciting dialogue as it evolves over time. Just a real quick slide here on the First Nations Health Authority. You see the notion of nothing for us without us, a very important piece that reflects who we are and that we own our own health and wellness, and that we make decisions about those. So the First Nations Health Authority has a lot of work to do. We worked with our First Nations people to try and develop an approach that would capture our holistic perspective on health and wellness. And I'll show you a bit about that in a little bit here. And so we are the champion of that approach now that we've confirmed it with our First Nations communities. And we talk about that with our government partners and our service provider partners and the colleges and the universities. And we look at that and ask them, how can they support us in our work to be a champion, not only a champion of that, but to be a partner to every First Nations person on their health and wellness journey. So we continue to work along that line, and we move that work ahead that way. As the First Nations Health Authority, we work alongside the ministry and the province. So a very strategic policy agenda involved with universities and others. So above and beyond the service provision that we do. So this diagram here really, kind of captures a number of concepts. One is this notion of being part of an ecosystem of health and wellness, that everything to us is connected, and collectively we do the work together moving forward. In the center, you see the perspective health and wellness. It talks about the human being in the center. And beyond that, every human being owns their own health and wellness journey. So we started a notion that it starts with me. Every person owning their own health and wellness journey can do something today to improve their health and wellness. Now, we recognize that the First Nations Health Authority is a health and wellness partner to every First Nations person, and that we need to meet them at where they're at, because some people are quite ready to take on that responsibility. Other people want us to work differently with them, and we need to understand what that looks like. And we see that partnership is a big part of this, but this also reflects our decision-making framework that gets us to that notion that we always ensure that First Nations decision-making is underlining and underpinning everything that we do. So there's a lot here in this diagram, and I could speak to this for probably half a day, but moving forward, one of the pieces that we've talked about, and it was mentioned here, the notion of cultural competency. And we've had discussions in our tripartite plans around cultural competency, and we really pushed back on that notion around it because it was becoming too much of an academic exercise. People would take some online training and then tick a box and say they're culturally competent. And we'd say, well, no, you're not. That's just the beginning of the journey. So we've talked about the notion of achieving cultural safety through cultural humility and having a bigger and broader discussion about what that looks like. And what we've been able to do here is have a declaration signed off by all senior officials in the Deputy Minister and the CEOs of the regional health authorities and provincial health authority, myself, as a shared commitment around cultural safety and humility, moving it forward. And we started to move this forward, not only from a vision from the First Nations Health Authority, but again, the notion that it starts with me, that every healthcare provider can change the narrative that exists when a First Nations person enters a health service facility that's run by the province. But we also recognize that we need to support that work with the province to ensure that we create a safe space so that people that are in the provincial health system can actually acknowledge when they see culturally unsafe services and treatment of an Indigenous person and raise the issue in a safe way in a very hierarchical system that's quite difficult to do. Anyway, I mean, we've captured a bit here some of the work we're doing in research. There's a lot of work the First Nations Health Authority is doing alongside our provincial partners at the ministry and the regional health authority level, our colleges, our universities, and others. And we grapple with, in each and every one of these areas, implementing our approach that's driven through First Nations decision-making and ways of being and knowing. So this is an example of it moving into the research agenda, and we have a lot of stories around our experiences in the past and how we want to see it moving forward. And I know, like I say, in 12 minutes, it's really difficult to capture all the things I'd like to share with you, but that's the beginning. So thank you very much.